How can a nurse differentiate between dementia and delirium in elderly patients, and why is accurate differentiation important for nursing care? Answer: Dementia and delirium are both cognitive disorders common in geriatric patients but have distinct differences. Dementia is a chronic, progressive decline in cognitive function due to disorders like Alzheimer's disease. It affects memory, problem solving, and language over time without abrupt changes. Delirium, on the other hand, is an acute, often reversible condition marked by sudden confusion, disorientation, and agitation, usually caused by an underlying medical issue like infection or medication side effects. Accurate differentiation is crucial as treatment plans differ. Dementia requires long-term management with supportive care and safety measures. Delirium is often a medical emergency that needs immediate intervention to address the root cause, e.g., sepsis, dehydration, electrolyte imbalance. A nurse should assess the onset, progression, and possible triggers. Delirium: rapid onset, fluctuating course, identifiable triggers, infection, medications. Dementia: gradual onset, steady cognitive decline, relevant guideline. National Institute for Health and Care Excellence (NICE) recommends early diagnosis and tailored care plans based on the type of cognitive impairment for better patient outcomes. What are the risks associated with polypharmacy in elderly patients, and what strategies can nurses employ to minimize these risks? Answer: Polypharmacy refers to the use of multiple medications, commonly seen in elderly patients managing chronic conditions such as hypertension, diabetes, and arthritis. The risks include increased likelihood of drug-drug interactions. Some medications can potentiate or inhibit the effects of others, leading to adverse reactions. Non-adherence: the complexity of managing multiple medications may lead to confusion and incorrect dosing. Increased risk of side effects: elderly patients have altered pharmacokinetics, meaning their bodies process drugs differently, heightening the risk of toxicity. Nurses can mitigate these risks by conducting regular medication reviews, collaborating with healthcare providers to assess the necessity of each drug and eliminate unnecessary medications. Patient education: teaching patients the importance of adhering to their medication schedule and recognizing side effects. Monitoring for adverse effects: frequent checkups to identify early signs of drug-drug interactions or toxicity. Mr. Thompson, an 80-year-old patient with mild cognitive impairment, has recently had 2 falls at home. He lives alone, and his daughter is worried about his safety. What strategies should the nurse recommend to prevent future falls, and what factors should be considered when assessing his risk? Answer: to prevent future falls, the nurse should implement a multifaceted approach. Environmental modifications: remove tripping hazards such as loose rugs or clutter, install grab bars in the bathroom, and improve lighting in hallways and stairwells. Use of assistive devices: recommend the use of a walker or cane if Mr. Thompson has mobility issues. Consider balance exercises or physical therapy to improve strength and coordination. Medication review: assess Mr. Thompson's medications for side effects like dizziness or hypertension, which can increase fall risk. Cognitive considerations: since Mr. Thompson has cognitive impairment, ensure that he has a simplified daily routine and visual cues around the house for guidance. Additionally, the nurse should involve family members in monitoring his condition and educating them on what to do if a fall occurs. In the context of a flu outbreak in a long-term care facility, what are the key infection control measures a nurse should implement to prevent the spread of the virus among residents? Answer: during a flu outbreak, infection control measures are critical to protect vulnerable populations, particularly elderly residents. Key measures include isolation: infected residents should be isolated from healthy individuals to minimize transmission. Vaccination: encourage flu vaccinations for both residents and healthcare staff to boost immunity. And hygiene: implement strict hand washing protocols for both staff and residents. Alcohol-based hand sanitizers should be available throughout the facility. Personal protective equipment (PPE): staff should wear gloves, masks, and gowns when interacting with infected residents to reduce exposure. Environmental cleaning: frequently disinfect high-touch surfaces, including doorknobs, bedrails, and shared equipment, to reduce virus spread. Limiting visitors: temporarily restrict non-essential visitors and implement symptom screening for those who must enter the facility. What are the primary goals of hospice care, and how does it differ from curative treatment in end-of-life care for terminally ill patients? Answer: hospice care focuses on comfort and quality of life for terminally ill patients who are nearing the end of life, typically with a prognosis of 6 months or less. The primary goals include pain and symptom management, ensuring that the patient is comfortable without focusing on curing the underlying disease; emotional and psychological support, providing counseling and support to both the patient and their family as they face the end of life; spiritual care, addressing the spiritual needs of the patient, often in collaboration with chaplains or spiritual advisors. In contrast to curative treatment, which aims to prolong life or eradicate disease, hospice care accepts death as a natural part of life and seeks to provide dignity and comfort during the dying process. A relevant guideline, the National Hospice and Palliative Care Organization (NTPA) provides best practices for hospice care, emphasizing patient-centered approaches. What are the roles of nurses in coordinating home health care for patients with chronic conditions, and why is interdisciplinary collaboration important? Answer: in home health care, nurses play a pivotal role in monitoring patient health, conducting regular assessments to ensure the patient's condition is stable, and adjusting care plans as needed. Patient education, teaching patients and caregivers how to manage chronic conditions, including wound care, medication administration, and use of medical devices. Communication, acting as a liaison between the patient and healthcare providers, ensuring that all necessary information is shared among the team. Interdisciplinary collaboration is vital because chronic conditions often require input from various healthcare professionals, e.g., physicians, social workers, physical therapists. Effective collaboration ensures that care is holistic and addresses all aspects of the patient's needs, improving outcomes and preventing hospital readmissions. Why are balance exercises critical in fall prevention for elderly patients, and how can nurses incorporate these exercises into a patient's care plan? Answer: balance exercises are essential in fall prevention because they help improve muscle strength, coordination, and proprioception, awareness of body position, all of which decline with age. This reduces the risk of falls, which are a leading cause of injury in the elderly. Nurses can incorporate balance exercises by referring patients to physical therapy. A therapist can create a tailored program focused on improving balance. Teaching simple exercises, for example, standing on one leg or walking heel to toe, can help improve stability. Monitoring progress, regularly assessing the patient's balance and adjusting the difficulty of exercises as they improve. Guideline: the American Geriatric Society recommends balance training as part of a comprehensive fall prevention strategy. What are the triage responsibilities of a nurse in a mass casualty event, and how is the triage process structured? Answer: in a mass casualty event, nurses are responsible for quickly assessing and categorizing patients based on the severity of their injuries using the triage system. The goal is to prioritize care for those most in need of immediate attention while managing limited resources effectively. The triage categories often include immediate red, life-threatening conditions that require immediate intervention, e.g., severe bleeding, airway obstruction; delayed yellow, serious but not life-threatening injuries. Care can be delayed, e.g., fractures; minor green, minor injuries that require minimal care, e.g., minor cuts or bruises; deceased black, patients who are either dead or unlikely to survive despite treatment. The START triage system, simple triage and rapid treatment, is commonly used in disaster scenarios. Discuss the importance of screening programs in elderly populations and the specific screenings recommended by health authorities. Answer: screening programs are crucial in elderly populations as they facilitate early detection of diseases, significantly improving the chances of successful intervention and management. Early diagnosis allows for timely treatment, which can lead to better health outcomes and reduce morbidity and mortality. Recommended screenings include blood pressure screening. Regular monitoring is essential as hypertension is common in older adults. Early detection helps manage cardiovascular risks. Cholesterol levels. Screening for lipid levels can identify individuals at risk for cardiovascular disease, enabling appropriate lifestyle modifications or pharmacotherapy. Diabetes screening. Testing for diabetes with fasting blood glucose or HbAC is recommended, especially for those with risk factors like obesity or a family history of diabetes. Cancer screenings, mammograms. For breast cancer screening, usually starting at age 50 or earlier for those with risk factors. Colonoscopy for colorectal cancer screening, typically starting at age 4550, depending on individual risk factors. Prostate-specific antigen assay testing for prostate cancer. Discussion about screening options typically occurs around age 50 or earlier for at-risk populations. Bone density testing for osteoporosis screening, particularly in postmenopausal women and older men, to prevent fractures. Vision and hearing assessments. Regular checkups can identify changes that may impact quality of life and functional abilities. Guideline: the U.S. Preventive Services Task Force recommends these screenings based on their effectiveness in reducing morbidity and mortality in at-risk populations. Additionally, the American Geriatric Society advocates for a patient-centered approach in deciding which screenings are appropriate based on individual health status and life expectancy. How should a nurse approach the management of an elderly patient with multiple chronic diseases such as diabetes and heart failure to ensure optimal health outcomes? Answer: managing an elderly patient with multiple chronic diseases requires a holistic and coordinated approach. Key strategies include comprehensive assessment, regularly evaluate the patient's overall health, including physical, emotional, and social factors, to tailor the management plan effectively. Consider the patient's functional status, mental health, and social support systems. Individualized care plans. Create care plans that address all chronic conditions simultaneously, considering how they interact, e.g., managing diabetes without exacerbating heart failure. For example, ensure that dietary recommendations for heart failure, low sodium, do not conflict with diabetic meal planning. Medication management. Regularly review medications to prevent polypharmacy and reduce the risk of adverse drug interactions. Collaborate with pharmacists to optimize medication regimens. Patient education. Empower patients by educating them about their conditions, medication management, and lifestyle changes, e.g., diet, exercise. Encourage self-management strategies that involve the patient in their own care. Interdisciplinary collaboration. Work with a team of healthcare professionals to provide integrated care. This may include dietitians for nutrition advice, physical therapists for rehabilitation exercises, and social workers for addressing psychosocial issues. Regular monitoring. Schedule regular follow-ups to assess the effectiveness of the management plan, monitor for complications, and make necessary adjustments. Utilize telehealth when appropriate to maintain continuity of care. Guideline. The chronic care model emphasizes the importance of informed, activated patients and prepared, proactive practices in managing chronic diseases effectively. Additionally, the American Diabetes Association and Heart Failure Society of America provide specific guidelines for managing patients with diabetes and heart failure, respectively, emphasizing a comprehensive approach to care. What are the key considerations in the pharmacological management of hypertension? Answer: hypertension is a common condition characterized by elevated blood pressure, which can lead to serious complications if left untreated. The goal of pharmacological management is to achieve a blood pressure reading of less than 138 mmHg as per guidelines set by the American College of Cardiology (AC) and American Heart Association (AHA). Common classes of antihypertensive medications include thiazide diuretics, ACE, inhibitors, angiotensin receptor blockers, ARBs, calcium channel blockers, and beta blockers. A comprehensive approach to managing hypertension involves lifestyle modifications such as dietary changes, diet, regular physical activity, and weight management. The recommended initial pharmacotherapy depends on the patient's comorbidities and demographics. For example, thiazide diuretics are often the first-line treatment for patients with uncomplicated hypertension, while ACE inhibitors may be preferred in patients with diabetes or heart failure. It's also crucial to regularly monitor blood pressure and adjust medications accordingly to avoid adverse effects such as hypotension or electrolyte imbalances. What is the significance of ECG in clinical practice, and how a common arrhythmia is identified? Answer: an electrocardiogram (ECG) is a vital tool used in the assessment of cardiac rhythm and function. Understanding the basics of ECG interpretation involves recognizing the components of the ECG waveform, including P waves, QRS complexes, and T waves, which represent atrial depolarization, ventricular depolarization, and ventricular repolarization, respectively. Common arrhythmias such as atrial fibrillation, ventricular tachycardia, and complete heart block can be identified through specific characteristics on the ECG. For instance, atrial fibrillation is characterized by the absence of distinct P waves and an irregular RR interval. In contrast, ventricular tachycardia typically presents with wide QRS complexes and a rapid heart rate. Healthcare providers must be adept at interpreting these rhythms and understanding the clinical implications. For example, recognizing signs of ischemia, such as segment elevation or depression, is critical in the acute management of myocardial infarction. Prompt identification and appropriate intervention can significantly impact patient outcomes. What are the nursing responsibilities in post-operative care for cardiac surgery patients? Answer: post-operative care following cardiac surgery is crucial for patient recovery and minimizing complications. Key components of this care include monitoring vital signs, assessing for signs of infection, and managing pain. Sternal precautions are particularly important as they help prevent complications such as sternal dehiscence. Patients should be instructed to avoid lifting more than 5 to 10 pounds using their arms for support while rising from a sitting position and avoiding twisting motions. Monitoring for complications such as arrhythmias, bleeding, or signs of heart failure is essential. Healthcare providers should also ensure that patients receive appropriate medications, including anticoagulants and beta blockers, as prescribed. Patient education plays a vital role in recovery, emphasizing the importance of adhering to follow-up appointments, recognizing warning signs of complications, and adopting lifestyle changes to support cardiac health. References: AHA Guidelines for Cardiac Surgery Postoperative Care, Sternal Precautions After Cardiac Surgery Protocol. What are the essential components of managing a patient with chronic obstructive pulmonary disease (COPD)? Answer: chronic obstructive pulmonary disease (COPD) is a progressive lung disease characterized by airflow limitation and is often caused by smoking or environmental factors. Effective management involves a multifaceted approach, including smoking cessation, bronchodilator therapy, corticosteroids, and pulmonary rehabilitation. Patients should be educated on using inhalers correctly, as proper technique ensures optimal medication delivery. Long-acting beta agonists, LUBAs, and inhaled corticosteroids are commonly prescribed to improve lung function and reduce exacerbations. Oxygen therapy is indicated for patients with severe hypoxemia, and devices such as nasal cannulas or non-rebreather masks may be used based on the patient's condition. Additionally, healthcare providers should develop an action plan for exacerbations, including recognizing symptoms and when to seek medical help. Regular follow-up and monitoring of lung function through spirometry are critical to adjusting treatment plans based on disease progression. References: GOLD Guidelines for the Management of COPD, National Heart, Lung, and Blood Institute (SEI) COPD Resources. How should nurses care for patients with colostomies? Answer: colostomy care is essential for patients who have undergone a colostomy procedure where a portion of the colon is diverted to an external stoma. Nursing responsibilities include assessing the stoma for color, size, and any signs of irritation or necrosis, as well as ensuring that the output is within expected parameters. The nurse should instruct the patient on how to change the ostomy appliance, emphasizing skin care to prevent complications such as skin breakdown or infection. It's vital to educate the patient about dietary modifications, hydration, and recognizing signs of potential complications such as stoma obstruction or excessive output. Patients should also receive support in adjusting to lifestyle changes, including managing body image concerns and incorporating ostomy care into daily routines. Psychological support may be necessary to address emotional challenges associated with living with an ostomy. References: WOCN Guidelines for Ostomy Management, Patient Education Resources for Colostomy Care. What are the nursing considerations in the care of a patient with a cast? Answer: cast care is critical in the management of patients with fractures or post-surgical interventions. The primary goals are to maintain the integrity of the cast and ensure proper healing of the affected area. Nurses should assess the casted limb for circulation, sensation, and movement, frequently checking for signs of compartment syndrome, which can occur due to increased pressure within the muscle compartments. It is important to educate patients on keeping the cast dry and avoiding inserting objects into the cast to scratch and itch. Monitoring for signs of infection, such as foul odors or drainage, is also essential. Patients should be instructed on the importance of elevating the limb to reduce swelling. Healthcare providers should be aware of the potential for skin breakdown and pressure ulcers around the cast edges, implementing preventive measures as needed. Follow-up appointments are vital for cast removal and further evaluation of the healing process. References: AORN Guidelines for Cast Care, American Academy of Orthopedic Surgeons, AOR's recommendations. What should nurses monitor in patients undergoing dialysis? Answer: dialysis is a critical treatment for patients with renal failure, requiring comprehensive nursing care for both hemodialysis and peritoneal dialysis patients. Hemodialysis involves the use of a dialysis machine to filter waste products from the blood, while peritoneal dialysis uses the peritoneum as a membrane for waste exchange. In hemodialysis, nurses must assess vascular access sites at fistula or graft for patency and signs of infection. Monitoring vital signs and laboratory values is crucial to ensure safe and effective treatment. Common complications include hypotension, electrolyte imbalances, and access-related issues. For peritoneal dialysis, education on the procedure, including aseptic technique during exchanges and monitoring for signs of peritonitis, is essential. Patients should be instructed to report any abdominal pain or cloudy effluent immediately. Both forms of dialysis require ongoing patient education, nutritional counseling, and psychosocial support to help patients manage their chronic condition effectively. How should nurses conduct a neurological assessment? Answer: Neurological assessment is fundamental in evaluating patients with suspected neurological disorders, including stroke, seizures, and degenerative diseases. The Glasgow Coma Scale (GCS) is commonly used to assess the level of consciousness, with scores ranging from 3 deep coma to 15 fully alert. A comprehensive neurological assessment includes evaluating motor and sensory functions, reflexes, and cranial nerve integrity. Nurses should look for asymmetry in strength or sensation, which can indicate the central nervous system lesion. Fall prevention strategies are crucial, particularly in older adults or those with cognitive impairments. Implementing safety measures such as ensuring a clear environment and providing assistive devices helps minimize the risk of falls. Nurses must also assess for signs of confusion and delirium, which may require further investigation into underlying causes, including metabolic derangements or medication side effects. References: AHA Guidelines for Stroke Management, Nursing Standards for Neurological Assessment. What are the best practices for insulin administration in diabetic patients? Answer: Diabetes management requires an understanding of insulin administration and the various types of insulin available, including rapid-acting, short-acting, intermediate-acting, and long-acting insulins. The primary goal is to maintain blood glucose levels within the target range to prevent complications associated with hypoglycemia and hypoglycemia. Healthcare providers must educate patients on the proper technique for insulin injection, including site rotation to prevent lipodystrophy. The timing of insulin administration in relation to meals is crucial, particularly with rapid-acting insulin, which should be administered approximately 15 minutes before a meal. Patients should be aware of signs and symptoms of hypoglycemia, such as shakiness, sweating, and confusion, and know how to treat it promptly. Monitoring blood glucose levels regularly and adjusting insulin dosages based on carbohydrate intake and activity levels is essential for effective diabetes management. References: ADA Standards of Medical Care in Diabetes Insulin Administration Guidelines. What are the common side effects of chemotherapy, and how should they be managed? Answer: Chemotherapy is a cornerstone in cancer treatment, but it often comes with a range of side effects that can significantly affect the patient's quality of life. Common side effects include nausea, vomiting, fatigue, hair loss, and myelosuppression, which increases the risk of infections and bleeding. Proactive management of side effects is critical. For instance, antiemetic medications can help control nausea and vomiting, and patients should be educated on dietary modifications to improve appetite and reduce gastrointestinal discomfort. Fatigue management may include encouraging patients to balance activity with rest, while hair loss should be addressed through supportive counseling and options such as wigs or hats. Regular monitoring of blood counts is necessary to manage myelosuppression, and prophylactic measures may be indicated to prevent infections. Healthcare providers should prioritize open communication, encouraging patients to report side effects promptly, as timely intervention can alleviate discomfort and enhance the overall treatment experience. A 60-year-old male patient presents with a heart rate of 120 beats per minute and a blood pressure of 106 to 100 mmHg. His temperature is 36.8 and respiratory rate is 22 breaths per minute. Based on this information, what abnormalities are present and what is the most likely cause? Answer: a 60-year-old male patient presents with a heart rate of 120 beats per minute, tachycardia, and a blood pressure of 106 to 100 mmHg, hypertension. His temperature is normal at 36.8 and his respiratory rate is slightly elevated at 22 breaths per minute. Tachycardia can be caused by factors such as anxiety, pain, fever, hypovolemia, or underlying cardiovascular issues. It's crucial for the nurse to perform a comprehensive assessment, including obtaining a thorough history of the patient's medical conditions, medication use, and lifestyle factors. Monitoring for symptoms like chest pain, palpitations, dizziness, or shortness of breath is vital, as they can indicate more serious cardiovascular issues. Immediate interventions may include placing the patient in a comfortable position, providing oxygen if needed, and initiating a cardiac monitor to assess for arrhythmias. Additionally, the nurse should collaborate with the healthcare team to discuss potential diagnostic tests, such as an ECG and blood work to evaluate electrolytes and cardiac enzymes. Follow-up care will likely involve monitoring blood pressure regularly and implementing lifestyle modifications, including dietary changes and stress management strategies in conjunction with pharmacological interventions as prescribed. MS Davis, a 72-year-old patient with diabetes, has a stage II pressure ulcer on her sacral area. The wound is exuding a moderate amount of serous fluid, and the edges appear macerated. The physician orders a wet to dry dressing change every 12 hours. What considerations should the nurse take into account when performing the dressing change, and what complications should the nurse monitor for? Answer: in caring for MS Davis, a 72-year-old patient with a stage II pressure ulcer, the nurse must prioritize proper wound management to facilitate healing and prevent complications like infection. When changing the wet to dry dressing, the nurse should first assess the wound for size, depth, and any signs of infection, redness, warmth, increased drainage. The dressing should be removed carefully to avoid damaging granulation tissue. The application of a moist dressing is crucial as it promotes autolytic debridement, allowing the wound to heal from the inside out while keeping the surrounding skin intact. If the edges are macerated, the nurse should ensure that the dressing does not overlap onto healthy skin. Using a hydrocolloid or foam dressing can provide a moist environment without excessive moisture accumulation. Patient education is also essential. MS Davis should understand the importance of nutritional support, including adequate protein and hydration, to promote healing. The nurse should monitor her blood glucose levels closely, as hypoglycemia can impair wound healing in diabetic patients. Documentation should include the wound assessment, the dressing used, the procedure performed, and any patient education provided. A patient is prescribed 150 mg of a medication. The available vial contains 100 mg to ml. How many milliliters should the nurse administer to the patient? Answer: when a patient receiving IV fluids presents with swelling and discomfort at the IV site, the nurse must assess for infiltration. This occurs when IV fluid leaks into the surrounding tissues instead of remaining in the vein. Signs of infiltration include coolness at the site, swelling, and slowed or stopped infusion rates. Immediate intervention is required to prevent further complications. The nurse should stop the IV infusion immediately and carefully remove the catheter. Elevating the affected limb can help reduce swelling, and applying a warm compress may assist in reabsorbing the fluid into the tissues. Continuous assessment of the site for any changes is essential. Furthermore, it is crucial to monitor the patient for symptoms of extravasation, where a vesicant drug leaks into the tissue, which can cause significant tissue damage. If extravasation is suspected, the nurse should follow specific protocols depending on the medication involved, which may include aspirating the area, applying heat or cold, and consulting the healthcare provider for further management. Documentation of the incident is vital, including details of the IV site assessment, interventions taken, patient education provided, and any changes in the patient's condition. A patient with chronic pain from osteoarthritis has been prescribed ibuprofen. What are the key safety considerations the nurse should educate the patient about regarding long-term NSAID use? Answer: when managing chronic pain in a patient with osteoarthritis who has been prescribed ibuprofen, a nurse must educate the patient about the benefits and potential risks of non-steroidal anti-inflammatory drugs, NSAIDs. While ibuprofen can effectively relieve pain and inflammation, long-term use poses certain risks. Firstly, the nurse should inform the patient about the gastrointestinal (GI) risks associated with NSAIDs. Prolonged usage can lead to gastric ulcers or gastrointestinal bleeding, especially in older adults or those with a history of peptic ulcer disease. Patients should take ibuprofen with food or milk to mitigate these effects, and should be instructed to report symptoms like black stools or abdominal pain immediately. Secondly, renal function can be compromised by chronic NSAID use. The nurse should recommend routine monitoring of kidney function through blood tests that measure serum creatinine and blood urea nitrogen (BUN). Lastly, cardiovascular risks are significant, as prolonged NSAID use may increase the risk of heart attacks and strokes. The nurse should discuss these risks and the importance of lifestyle modifications, such as maintaining a healthy diet and regular physical activity to support cardiovascular health. A patient receiving IV fluids through a peripheral line complains of swelling and discomfort at the insertion site. On examination, the site is cool to the touch and the IV flow rate has slowed. What complication is the patient most likely experiencing, and what should the nurse do? Answer: when a patient receiving IV fluids presents with swelling and discomfort at the IV site, the nurse must assess for infiltration. This occurs when IV fluid leaks into the surrounding tissues instead of remaining in the vein. Signs of infiltration include coolness at the site, swelling, and slowed or stopped infusion rates. Immediate intervention is required to prevent further complications. The nurse should stop the IV infusion immediately and carefully remove the catheter. Elevating the affected limb can help reduce swelling, and applying a warm compress may assist in reabsorbing the fluid into the tissues. Continuous assessment of the site for any changes is essential. Furthermore, it is crucial to monitor the patient for symptoms of extravasation where a vesicant drug leaks into the tissue, which can cause significant tissue damage. If extravasation is suspected, the nurse should follow specific protocols depending on the medication involved, which may include aspirating the area, applying heat or cold, and consulting the healthcare provider for further management. Answer: effective pain management begins with accurate pain assessment, which is vital for guiding treatment decisions. Several pain assessment scales are used in clinical practice to evaluate a patient's pain level. Among the most common is the numeric rating scale (RS), where patients rate their pain on a scale from 0, no pain, to 10, worst possible pain. This scale is simple and effective, making it suitable for adults and cognitively intact patients. Another widely used tool is the visual analog scale (VAS), which provides a line marked with descriptors e.g. no pain, moderate pain, severe pain, and patients mark their pain level on the line. This scale can be beneficial for patients who have difficulty verbalizing their pain levels. The Wong-Baker FACS pain rating scale is particularly effective for children or individuals with communication challenges. It consists of cartoon faces ranging from happy no pain to crying very severe pain, allowing patients to express their pain in a relatable way. Selecting the appropriate pain scale depends on the patient's age, cognitive ability, and personal preference. For example, a cognitively impaired patient may benefit from a VDS or Wong-Baker scale, while an alert adult may find the NRS more straightforward. What dietary considerations should a nurse communicate to a patient with heart failure regarding sodium intake? Answer: for a patient with heart failure, adhering to a sodium-restricted diet is critical for managing fluid retention and reducing the workload on the heart. A nurse should educate the patient on several key dietary modifications to help them comply with this restriction while still enjoying their meals. First, the nurse should emphasize the importance of avoiding processed foods, as these often contain high sodium levels due to preservatives and flavor enhancers. Common examples include canned soups, deli meats, frozen meals, and snack foods like chips and crackers. Instead, the patient should be encouraged to prepare fresh foods at home, using herbs and spices to enhance flavor without adding salt. The nurse should also educate the patient on how to read food labels effectively. Patients should learn to look for terms like low sodium, no added salt, or sodium free when shopping for groceries. Additionally, it's important to be cautious with condiments and sauces, which can be high in sodium, and to explore low sodium alternatives. Another important aspect is to educate the patient about meal planning and preparation, suggesting that they incorporate a variety of fruits, vegetables, whole grains, and lean proteins can help them create balanced meals without excess sodium. For instance, using fresh herbs, lemon juice, or vinegar can add flavor to dishes without the need for salt. Regular follow-ups are essential to monitor the patient's adherence to the dietary plan and assess any changes in their condition. The nurse should encourage open communication, allowing the patient to express any difficulties they face in adhering to the diet, thus enabling the nurse to provide tailored support and resources. In summary, effective patient education on sodium restriction can significantly improve the management of heart failure and enhance the patient's quality of life. Mr. Green, a 68-year-old patient recovering from hip surgery, is noted to be unsteady when ambulating with a walker. He has a history of falls and expresses fear of falling again. What interventions should the nurse implement to reduce Mr. Green's risk of falls, and what are the legal responsibilities of the nurse in documenting fall prevention measures? Answer: to reduce Mr. Green's fall risk, the nurse should assess fall risk, utilize a fall risk assessment tool such as the Morse Fall Scale, ensure a safe environment, keep his bed at the lowest position, remove tripping hazards, and ensure he has easy access to the core light, educate on safe mobility, instruct Mr. Green on proper use of his walker, and encourage slow, deliberate movements when changing positions. Documentation should include the fall risk assessment score, education provided on safe mobility and use of assistive devices, implementation of fall prevention strategies e.g. hourly rounding, placement of core light. Legal responsibility involves documenting all interventions to demonstrate adherence to standard care protocols and to reduce liability in case of a fall. When collecting a blood sample via venipuncture, what steps should the nurse follow to ensure accurate and safe specimen collection, and what are common complications associated with improper technique? Answer: steps for proper venipuncture: identify the patient using two identifiers, e.g. name, date of birth, choose the appropriate vein, typically the antecubital fossa, apply a tourniquet to enhance vein visibility, ensuring it's not too tight to avoid hemoconcentration, cleanse the site with antiseptic in a circular motion, insert the needle at a 1.5-3 degree angle with bevel up, Common complications: hematoma formation due to improper needle insertion or failure to apply pressure after removal, hemolysis from using a needle that's too small or vigorously shaking the specimen tube, infection if a septic technique is not followed. Guidelines: Clinical and Laboratory Standards Institute (CLSI) phlebotomy standards. What are the essential steps in Foley catheter care to prevent urinary tract infections, UTIs, and what signs should a nurse monitor for that might indicate a catheter-associated UTI, CAUTI? Answer: Steps for proper Foley catheter care. Hand hygiene before and after handling the catheter. Daily perineal hygiene using soap and water. Maintain a closed drainage system and ensure the catheter tubing is free of kinks. Position the drainage bag below bladder level but off the floor to prevent backflow. Empty the bag regularly without touching the spout to any surfaces. Signs of CAUTI include cloudy or foul-smelling urine, fever, chills, or lower abdominal pain, elevated white blood cell count or positive urine culture results. Guidelines: Centers for Disease Control and Prevention (CDC) recommendations for catheter-associated UTI prevention.